Did you know your body can whisper warning signs long before a blood test shows anything is wrong? It could be something as simple as constant tiredness, or as unusual as tingling in your feet, memory lapses, or even strange changes in your tongue. Most of us brush off these little things as stress, aging, or just bad habits. But in many cases, they're signals that your body is running low on one of the most vital nutrients for energy and nerve health, vitamin B12. The tricky part is that B12 deficiency doesn't always show up in obvious ways. Instead, it hides behind symptoms that seem unrelated. That's why so many people go years without realizing what's really going on. In this video, we're going to look at 12 unusual and often overlooked signs that your body may be asking for more vitamin B12. Stay with me until the end, because once you know these signs, you'll be able to spot them in yourself or loved ones long before they turn into something more serious. Sign 1. Constant fatigue and weakness. One of the most common but also most misunderstood signs of low vitamin B12 is persistent fatigue. This is not the tiredness you feel after a long day or a poor night's sleep. It is a deep exhaustion that lingers, even when you rest. People often describe it as feeling drained from the moment they wake up, with no real energy to carry through the day. The reason this happens is that vitamin B12 is critical for producing red blood cells. These cells carry oxygen to every part of your body. When B12 is low, fewer red blood cells are made, and the ones that do form may be abnormally large and less efficient. The result is less oxygen delivered to your muscles and brain. Without that oxygen, your body simply cannot generate enough energy, no matter how much you sleep. If you find yourself relying heavily on coffee or sugar just to stay awake, or if you feel unusually breathless during light activity, these could be subtle signals of a deeper B12 shortage. To correct this, focus on foods rich in B12, such as fish, poultry, eggs, and dairy. For vegetarians or vegans, fortified plant-based milks and cereals can help. In cases of severe deficiency, a doctor may recommend supplements or even B12 injections to quickly restore healthy levels. Sign 2. Numbness and tingling in hands or feet. Another strange sign of vitamin B12 deficiency is a tingling or pins and needles sensation, especially in the hands, feet, or legs. This feeling may come and go, but over time, it can become persistent. Some people even describe it as a light buzzing under the skin. This happens because vitamin B12 is essential for producing myelin, the protective sheath that surrounds your nerves. Myelin acts like insulation around electrical wires. Without enough B12, the insulation weakens, and nerve signals become slower or disrupted. The result is tingling, numbness, or a burning sensation in the extremities, which are the farthest points from the spinal cord. This symptom is particularly important because it signals damage to the nervous system, not just low energy. Left untreated, nerve problems caused by B12 deficiency can become permanent. If you notice numbness in your feet when walking, tingling in your fingers when typing, or unexplained weakness in your grip, don't dismiss it. These subtle signs may point to low B12. Sign 3. Pale or yellow-tinged skin. Another unusual sign of vitamin B12 deficiency shows up on your skin. People who are low in B12 often notice their skin becoming unusually pale, or in some cases, developing a slight yellowish tint. This is not the healthy glow that comes from fair skin. It's a washed-out look that makes you appear tired or unwell. The reason for this is linked to how B12 affects red blood cell production. When your body doesn't have enough B12, it produces fewer red blood cells, and the ones that do form can be fragile. These cells break apart more easily, releasing a pigment called bilirubin. Bilirubin is yellow, and when it builds up, it can cause your skin and the whites of your eyes to take on a faint yellow tone, similar to jaundice. This is different from ordinary paleness caused by being indoors or avoiding the sun. It's also different from anemia caused by low iron. In B12 deficiency, the skin can look both pale and slightly yellow at the same time, giving it a unique, unhealthy shade. If friends or family have commented that you look unusually pale or sickly, it's worth paying attention. When skin changes appear alongside fatigue or tingling, B12 deficiency should be considered. Sign 4. Mood changes and irritability. A less obvious but very real sign of vitamin B12 deficiency is a sudden shift in mood. People who are low in B12 often describe feeling unusually irritable, anxious, or even depressed without a clear reason. These changes may seem like stress or personality shifts, but in many cases, they are chemical signals from the brain. Vitamin B12 is essential for producing neurotransmitters, the brain's chemical messengers. It helps convert an amino acid called homocysteine into methionine, which is then used to make serotonin and dopamine. These are the very chemicals that regulate mood, motivation, and emotional balance. When B12 is lacking, homocysteine builds up and serotonin levels fall, leading to irritability, low motivation, or a flat mood. The symptoms can vary. Some people notice they snap more easily at family or coworkers. Others feel a constant sense of sadness or anxiety that doesn't improve with rest or relaxation. In older adults, low B12 can even contribute to confusion or memory lapses, which may be mistaken for early dementia. Unlike stress-related mood changes, this type tends to persist and may not improve until vitamin levels are restored. Sign 5. Glossy, red, or sore tongue. One of the stranger signs of vitamin B12 deficiency can be found right inside your mouth. People with low B12 sometimes develop a condition called glossitis, which literally means inflammation of the tongue. Instead of the normal rough texture, the tongue may appear unusually smooth, glossy, and bright red. It can also feel sore, tender, or even slightly swollen. This happens because vitamin B12 is required for maintaining healthy cells in the mouth and on the tongue's surface. Without enough of it, the small bumps that normally give the tongue its texture, called papillae, begin to shrink or disappear. This not only changes the way the tongue looks, but can also affect taste. Some people notice food tastes different, or they lose their appetite because eating becomes uncomfortable. Glossitis is not the same as a temporary burn from hot food or a mild irritation. It often lingers, and in some cases, it is accompanied by mouth ulcers, cracks at the corners of the lips, or a burning sensation in the mouth. Sign 6. Blurred vision or eye disturbances. Vitamin B12 deficiency doesn't just affect your blood, nerves, or skin. It can also affect your eyes. One of the stranger signs of low B12 is blurred or disturbed vision, sometimes described as seeing shadows, flashing lights, or blind spots. This happens because prolonged B12 deficiency can damage the optic nerve. This cable carries visual information from your eyes to your brain. Without enough B12, the myelin sheath protecting this nerve begins to wear down. Once that protective covering is compromised, nerve signals become weak or irregular. The result is vision that suddenly looks blurred, patchy, or distorted, even if your eyes themselves are healthy. This condition is called optic neuropathy, and while it is rare, it is a serious warning sign of long-standing deficiency. Some people may also notice sensitivity to light or difficulty focusing for long periods, like when reading or working on a computer. If you experience unexplained vision changes and your eye exam looks normal, low B12 could be the hidden cause. The good news is that when caught early, vision often improves once B12 levels are restored. Sign 7. Shortness of breath and dizziness. Another unusual sign of vitamin B12 deficiency is feeling short of breath or lightheaded, even during simple activities. You might notice it when climbing a short flight of stairs, walking quickly, or sometimes even while sitting still. Some people also report frequent dizziness or feeling faint without an obvious reason. This occurs because B12 is needed to produce healthy red blood cells. When levels are low, your body makes fewer red blood cells, and the ones that do form may not carry oxygen efficiently. With less oxygen traveling through your bloodstream, your organs and muscles struggle to perform. The result is that breathless, weak feeling that shows up far sooner than it should. It's important to understand that this type of shortness of breath is different from the kind caused by lung or heart conditions. With B12 deficiency, the problem lies in how much oxygen is being delivered, not how well your lungs take it in. Sign 8. Memory problems and poor concentration. Have you ever walked into a room and completely forgotten why you went there? Or struggled to stay focused on simple tasks that used to feel easy? While occasional forgetfulness happens to everyone, frequent lapses in memory and poor concentration can be a sign of vitamin B12 deficiency. B12 is essential for producing neurotransmitters and maintaining the protective myelin coating around brain cells. Without enough of it, the communication between brain cells slows down. This can make it harder to process information quickly, recall details, or concentrate on complex tasks. Some people even describe it as brain fog, where their thinking feels slower and less clear than usual. This is not the same as age-related memory loss or distraction from stress. With B12 deficiency, memory problems often appear suddenly and seem out of proportion to your age or situation. You may forget recent conversations, lose track of appointments, or struggle to follow through on tasks at work or school. The good news is that these symptoms often improve once B12 levels are corrected. Studies have shown that supplementation can enhance memory and cognitive performance, especially in people who were previously deficient. Sign 9. Ringing in the ears. Another surprising sign of vitamin B12 deficiency is a persistent ringing, buzzing, or hissing sound in the ears, a condition known as tinnitus. For some, the noise is constant, while for others it comes and goes, often more noticeable at night or in quiet environments. Vitamin B12 plays a key role in protecting and repairing the nervous system, including the delicate nerves involved in hearing. When levels are low, the myelin sheath around these nerves begins to deteriorate, making nerve signals less stable. The brain may then misinterpret these faulty signals as sound, which shows up as ringing in the ears. Tinnitus caused by B12 deficiency is often overlooked because people assume it is linked only to aging or loud noise exposure. But research has shown that low B12 can be an independent risk factor for auditory nerve problems, and supplementation has improved symptoms in some cases. If you experience unexplained ringing in the ears, especially when combined with other signs like fatigue, tingling, or vision changes, it may be worth checking your vitamin B12 levels. Sign 10. Brittle nails and hair loss. Your nails and hair can also reveal signs of vitamin B12 deficiency. People who are low in B12 sometimes notice their nails becoming brittle, ridged, or prone to breaking. In some cases, dark streaks or a bluish tint may appear on the nail bed. Hair may also thin more quickly, with increased shedding during brushing or washing. This happens because B12 is critical for healthy cell growth and oxygen delivery. Your nails and hair are made of rapidly dividing cells, which means they rely on a steady supply of nutrients and oxygen-rich blood. When B12 is low, fewer red blood cells are produced, and oxygen delivery to these cells decreases. The result is weaker nails and hair follicles that cannot grow properly. Unlike fatigue or tingling, this sign is visible, but it's often mistaken for aging, stress, or even cosmetic damage. If your nails split easily, or your hair suddenly looks thinner without changes in routine, it may be worth considering whether B12 deficiency is playing a role. The good news is that these changes are usually reversible. Once B12 levels return to normal, cell growth in nails and hair improves, and many people notice stronger nails and healthier hair within a few months. Sign 11. Rapid heartbeat. Another strange sign of vitamin B12 deficiency is a racing or irregular heartbeat, also known as palpitations. You may notice your heart pounding harder than usual, beating faster, or skipping a beat even when you're sitting still. Some people feel it as a fluttering in the chest, while others describe it as a strong thump that comes and goes. Low B12 reduces the production of healthy red blood cells, leading to anemia. With fewer red blood cells to carry oxygen, the heart has to work harder and pump faster to deliver oxygen to the body's tissues. Over time, this strain can cause noticeable palpitations and sometimes shortness of breath during exertion. These palpitations are different from those triggered by caffeine, stress, or sudden fright. When linked to B12 deficiency, they tend to occur regularly and often appear alongside other signs such as fatigue, dizziness, or pale skin. Sign 12. Frequent mouth ulcers. The last strange sign that your body may be low on vitamin B12 is the appearance of frequent mouth ulcers or sores. These are small, painful spots that can develop on the inside of the cheeks, the gums, or the tongue. For some people, they keep coming back even after healing, making eating and speaking uncomfortable. This happens because vitamin B12 is essential for cell repair and regeneration. When B12 is lacking, the delicate tissues inside the mouth are slower to heal, and they become more prone to irritation. At the same time, a weakened immune response makes it easier for ulcers to form and harder for them to go away. These mouth sores are not the same as the occasional blister, caused by biting your cheek or eating sharp food. They tend to appear more often, take longer to heal, and sometimes occur alongside other oral changes, such as a red sore tongue or cracks at the corners of the lips. Though mouth ulcers may seem like a small problem, when combined with fatigue, tingling, or mood changes, they can be an important clue that your body is asking for more vitamin B12. So friends, those were 12 strange but important signs your body may be asking for more vitamin B12. Some of them may look minor on the surface, but together they can reveal a serious deficiency that affects your blood, nerves, and even your brain. The good news is that once you recognize the signs and correct the deficiency, your energy, focus, and overall health can improve dramatically. If you found this video helpful, please give it a like, share it with someone who might need it, and subscribe to our channel for more practical health tips. Your support helps us reach more people who are looking for natural ways to feel better. Take care of your nutrition, listen to your body's signals, and remember, small changes can protect your health in big ways.